Hi, Mr. Butts. I'm Stephanie. I'm going to be your nurse today. We're just going to do that wound debridement and change your dressing. So I'm going to put the head of your bed up. And then can I get your first and last name? Perfect. And your birthday? Can I check your allergy band? Okay, perfect. Okay. Are you having any pain this morning? No? Okay, that's good. If you do have any pain at any time, we do have some pain meds available, so just ask. Perfect. Okay, I'm just gonna get my supplies ready, so we're ready to go. Tape on. Just gonna pour my saline in. I'm going to take your old dressing off and put it in the biohazard bag. Perfect. Just going to look and assess your drainage, which looks pretty yellow and purulent. Perfect. Take my gloves off. Wash my hands. Next, we're just going to do a little bit of debriding. This may cause some pain and discomfort, but we'll get it done as quickly as possible. Okay. Saline out of this. Going to tip you up on your side a little bit. I'm going to spray and clean the area, making sure to get into the tunneling. And I'm going to do this until it runs clear. Perfect. So now that we're done with that, I'm just going to assess your wound a little bit. So your wound is definitely red and deep. It looks like you do have a little bit of eschar on the sides. You can see your coccyx bone. You have a little bit of tunneling. I'm just going to do some measuring. Put my gloves back on. If I can get them back. Sterile slips. Just gonna 3 inches. Tunneling looks to be about 2 inches. This other source of tunneling is about 3 centimeters. And I would say your wound is 15 centimeters by 8 centimeters. Okay, discard that in the red biohazard bag. I'm going to discard my gloves. Just going to jot down what my findings are. Perfect. Okay. I'm just going to start to get set up for sterile portion. I'm going to open my ABD. Keeping it as sterile as possible. There we go. Okay, and then my sponges, I'm just going to pour a little bit of sterile water into. Coupling it up. And then staying within my borders, I'm going to place it right there. I'm going to do that with the subsequent ones as well. a little water. Recap my saline, and then I'm going to wash my hands and apply my sterile gloves. Get everything laid out. Then with my non-dominant hand, okay, sterile gloves on. To reach in and grab my okay. I'm going to grab my first gauze and try to pull it apart. Pull it into a long, thin dressing. Then I'm going to start by working it into the tunneling in a packed but not like extremely hard fashion, and never touching the skin. And I'm going to pack the last one in. Until the packing is level with the skin, but not above it. Oh. Okay, and then I'm going to pick up my ABD in the center. Kind of shake it loose and place it on the coccyx area and tape. Making sure that there aren't any holes in my taping. Okay. And then I'm going to remove my gloves. In there. I'm going to initial my patient's dressing with my initials, the date, 9/2 of 15, and the time that we did it, 14:15. Perfect. I'm going to clean up my area. Hands. I'm going to I'm going to make sure that the area is free and clear of clutter. I'm going to make sure that my patient's bed rail is up and the bed is in the lowest position. I did notice that he is NPO, so I would remove his water pitcher, but if he was not, then I would fill his water pitcher for him. I would remind him, my name is Stephanie, I'll be your nurse until 7 p.m. If you need anything else, I'll be here. Are you having any pain before I leave? Can I get you anything? No? Okay, well, I'll be back soon to check on you. We do hourly rounding here, so if you need anything before then, you put your call light on. Thank you.